Lenacapavir
Yes.
was approved by the FDA 3 weeks ago, roughly.
Yeah.
What does that approval mean? What because I know that it is HIV PrEP, right?
Yes. It previously had approval under the brand name Sunlenca, and that was for treatment, not by itself, but as an add-on for people that have a lot of drug resistance because it's a unique category. But since that time, they've had a number of studies running, and now they have it approved to prevent HIV transmission. So people can take this if they are at risk of becoming infected with HIV for any reason. Well, it's approved to prevent sexual transmission of HIV. It probably prevents HIV transmission quite well other ways too. And yes, it's every 6 month injection.
So this has already been out in the public and being used for people who are basically keeping their HIV under control.
Right. It's not real common because it's only for people who have drug resistance to a lot of the existing categories of HIV drugs. So it's approved as an add-on, when they have drug resistance. But yes, it's been out um, in the market for a couple of years for HIV treatment. And they
What
are looking for something to go along with it so that there can be potentially an every 6 month injection to treat HIV. But we're not there yet.
is are there what are the comparable drugs that are out there that people are using more regularly than HIV PrEP?
For HIV PrEP, a lot of Truvada. That was the first drug that was approved. The other drug, and that's a drug tablet that you take by mouth. Then the next medication on the market was Descovy, and that again is a pill that you take by mouth. And then a couple years ago, the first long-acting injectable was approved, and that is Apretude, and that is every 2 months an injection to prevent HIV. And
So
now
all
we
of
have
these fall under
Lenacapavir,
so all of these fall under the category of HIV PrEP though.
PrEP. Yes.
Why?
What do you mean, why?
What does HIV PrEP entail? What is
Um,
how does a drug qualify to be called that?
it has to be prevent HIV infections in a trial. Currently, the way that these trials are run, um, Truvada was approved in 2012. And that was really kind of a unique thing because that was the first time we had a drug approved to prevent HIV infection. And you just take a tablet every day and it prevents the majority of HIV infections. Now when they do trials, they will do a double blind trial where there will be typically two groups of people and they will both receive a tablet. And in this case, with the lenacapavir, both groups received an injection. One group was receiving a tablet with an active ingredient and a placebo injection. The other group received the injection with the active ingredient and a placebo tablet. This way, neither group knew which one was the active, but they were receiving both. So everyone had protection. And, because once you have something to prevent a disease or an infection, you can't just do a trial um, against placebo because you can't expose people or let people be exposed thinking they're protected when we can prevent it. But
Mm.
anyway, they run this trial over several years. The length just depends on how long it takes to recruit and get everything going. And then they will start to analyze data. They usually have the first date picked out to analyze data. And sometimes it's really good. The data is so good that they will say, you've got what you need. You can offer the new medication to everyone. I mean, yeah.
Well, tell me this, Barb. How does lenacapavir work in your body? What does it do?
It's what's called a capsid inhibitor. Then I'd almost have to show you the diagram, but the HIV virus has a number of different ways by which it enters the cells, replicates, etc. And all of the different drugs to prevent and treat HIV work at different places where the virus either is entering the um, T cell, the CD4 T cell, or where it is starting to replicate it. It interrupts those processes so that the cell or so that the HIV virus cannot replicate.
Okay. Or is it common yet? I know you said it's not as common as the other HIV PrEP drugs, but is this one that you're seeing purchase a lot? I mean, how many people do you see getting
On
this?
lenacapavir,
Yes.
no, not yet because it just got approved. Um, so once it gets the approval like this, in this case, since it's already been available for treatment, they've already been manufacturing it. They have anything like that is all taken care of. They have their process set up, so it goes pretty fast. But the next step is all the insurance companies have to decide if what they're going to pay, if they're going to cover it, etc. So at this point, I would expect that that might still take a little bit before people start routinely getting the lenacapavir. Generally, after a drug is approved, it isn't immediately covered under insurance. They have to go through their own little process to add a drug to their formulary and then say what they require. Part of the one issue with lenacapavir will be the cost. Um, I believe yeah, we're looking at probably $28,000 a year cost of the drug
Per person?
per person. But, so about $14,000 per injection, roughly. Yeah. And Truvada, the first drug that was approved to prevent HIV infections, is available as a generic.
How much is that?
So I want to say it's less than $100 a month, even without insurance. So you
Are
have
there,
that.
yeah, are there any other twice a years like
No,
lenacapavir?
no.
No. Okay.
This is the closest that we've ever come to having a vaccine for HIV because getting an injection twice a year is not much different than getting
Regular vaccine.
any type of like a flu vaccine in a booster. Um, it's the closest we've come. Despite all the trials they've done on vaccines, it's been very difficult.
So I know you said this one isn't on insurances yet or covered by insurances yet, but
Yeah.
the other ones that you mentioned for Medicaid patients, are they covered to get this without any copay? The other ones?
I am not involved in the clinic. I believe they are, but I am not involved in that aspect of the clinic. Um, so I don't want to have me quoted as saying for sure on that because uh,
What is the efficacy rate for lenacapavir, or do you know that yet?
extremely good. I think the first trial that was released, the information was a trial called Purpose One, and that was young women and girls in a couple of African countries. And initially, there were no infections. I believe later, as they continued to analyze stuff and people continued on it, there did end up being two infections. And that was out of, I want to say probably like 2,500 people. Then the second trial that was released, it was where I was going to say anyway, it was in cisgender men who have sex with men, transgender men, but non-binary people. And there were a couple infections, but they are saying probably at least 96%. efficacy.
That's pretty good.
Yeah.
So your outlook for people who use this is pretty good.
Yes. This um, brought so much excitement in the community um, for what it could mean in the US because kind of there hasn't been a lot of progress in the last couple of years. It's been really slow on preventing new HIV infections. And with the pills, they work quite well, but they require that somebody take them on a, daily basis. And that can be a struggle for a lot of people. There's a lot of reasons for that. Where an injection that you just go into the doctor's office twice a year and that's it. You don't have to worry about it in between. That's pretty incredible.
Yeah.
And
The
globally, it has the potential to really make an impact if the funding is there globally.
it does have a hefty price tag.
Yes.
Um,
And globally, the company has a plan to allow it to be produced by generic manufacturers for the lowest income countries at a much lower price tag. I don't know if it'll be low enough. I don't know with some of the funding cuts how the rollout would be. USAID, PEPFAR, that stuff.
Lenacapavir is the only preventative medication. There are other maintenance medications, just to
No, there
clarify.
are other preventative ones, but none of them that last this long.
Okay, gotcha.
Right.
Okay.
I
Um,
know it's it's a lot. Yeah.
I
This
just
it
want to.
makes the fourth preventative medication that is approved in the US. Another thing that is really cool about lenacapavir, um, we already have data on its use during pregnancy with breastfeeding, and there were no higher incidents of any issues. I think they're having a registry so they can continue to track data because it's always very important to continue to follow up on that data to make sure something doesn't show up when you get larger numbers. But to have this data um, it could be used in all adults and adolescents that weigh at least 77 pounds, regardless of gender, sex, um, all pregnancy, breastfeeding, potential stuff that could happen. All of those communities qualify.
I have one more question for you, Barb. Would you say, or how would you say these types of drugs have impacted the spread of HIV? Have they?
Oh, yes, definitely. There are a number of ways that we work to reduce the spread of HIV infections. Um, One of them, I'm sure you've heard of U equals U, undetectable equals untransmittable. So if someone with HIV is on medication and they are virally suppressed, they will not transmit. So there's that. But some people have HIV and don't know it.
Mm.
So then this is the thing that people can take to protect themselves and be proactive. And that is a huge difference. Before that, their only choice was um, condom use or abstinence. I mean, as far as sexual transmission goes. So to be able to take a pill or receive an injection and prevent HIV is huge. Yeah.
Do you know? I know I said last question. Do you know if this FDA approval several weeks ago, if this was something that was uncertain, that people were kind of waiting and
It was
unsure
pretty
on?
certain because the data was so good. Um, the first injectable had run into a few problems that had to do with packaging and how they were going to do stuff with one of their original, but because this one had already been on the market as part of a treatment plan, all those details of packaging distribution were already in place.
Mhm.
And the data was so good that it was quite certain as you can be when nothing is guaranteed. I mean,